I refer to this knot as the sticky slip knot. In many instances, when veterinarians need to tie something, some tissues that are under tension, they need to have a suture that will hold under tension. This technique is a surgeon's throw and can oftentimes be all that is necessary. However, on occasion and with various types of suture material, this surgeon's throw is not good enough. So what I recommend is tying a perfect square knot, as seen here, pulling up on one or the other ends of that perfect square knot, and it immediately turns into a slip knot. What that slip knot does is it increases the amount of friction and contact of suture around the piece of suture going between or through each of those slips. Because that amount of friction increases, you actually get a stickier knot. And as you can see here, this knot is holding under a tension situation without any effort on the surgeon's part to keep the knot tight. If this knot is used, it is highly recommended to place 4 throws, that would equal 2 square knots, to finish off the knot. Sticky slip knots can be done with any kind of suture material, but the ones that seem to respond the best are the monofilament non-absorbables, the monofilament absorbables, and the synthetic multifilament absorbable materials. And these are such as Biosin, Maxon, Polysorb, Dexon. Here we are again, just to show it one more time. Perfect square knot. Pull up on one end, turns it into a slip knot. The loops of suture around the strand increase the friction, and bingo, that will hold almost an indefinite amount of time and will hold better than the oftentimes used surgeon's throw. Here we will be doing the sticky slip knot technique using an instrument instead of hand ties. And I think you'll see that it works very nicely. We're going to use a piece of monofilament absorbable material such as Maxon. A perfect square knot is tied. The square knot is left loose. So first throw, second throw, a perfect square knot. One end is pulled to turn the square knot into a slip knot. Boom. Once that flips into the slip knot, then you can use your thumb and slip the knot down. Because of the increased friction, it will hold a very large amount of tension together in time for you to place 4 throws to secure the knot. Again, this works beautifully with any monofilament absorbable or non-absorbable suture material. Let's now do it with a multifilament synthetic absorbable such as Polysorb or Dexon. That's just stroking it to show you that it is a multifilament. It's a little hard to see. These are very frustrating to work with when you're working under tissue that's under tension. And in fact, what we'll do is we'll put a single throw to show you how slippery this material can be. And that just pops apart. And then we'll do a surgeon's throw. So let's do a double throw. Now this will generally work for most suture materials, but not for these very slippery multifilament absorbables. So very slippery. So let's go ahead and do our sticky slip knot technique, where we tie a perfect square knot. Keep it a little loose, pull up on one end of the suture to turn that into a slip knot that increases the friction around the strand of suture. It enables the surgeon to slip the knot down. And notice how when the suture is released, that the tissue under tension remains closed until the surgeon can place 4 throws to secure the suture in place. This is a very, very excellent way to utilize this suture to your advantage.